Good morning, viewers. Today, I'm going to tell you regarding varicocele. Varicocele is a condition where there is dilatation of pampiniform plexus of veins. That is, the blood vessels above the testis are dilated. There are so many controversies, there are so many doubts regarding whether the varicocele is a problem, it needs to be undergo surgery, or we can wait. So let me explain you briefly about it. Varicocele occurs in so many people. Okay, see, the main thing is radiology. So only clinically relevant varicoceles needs treatment. Okay, so varicocele can be divided into grade 1, 2 and 3. Okay, grade 1 is varicocele can be felt only with Valsalva maneuver, that is by coughing. We can palpate only by coughing like Valsalva maneuver. Grade 2 is without Valsalva maneuver, we can feel the varicocele. Grade 3, you can see the dilated veins. Okay, these dilated veins can be seen on the scrotum. This is 1, 2, 3 grades. So only clinically high grade varicoceles need treatment. Grade 1 varicoceles, not at all. Even if you treat them, there won't be a good results. So why you need to treat varicocele? So the most common reasons for varicocele treatment is infertility. So varicocele can be associated with some problems. The main common one is decreased sperm count, decreased sperm motility, sperm density. Infertility people who are having high grade varicocele that is clinically palpable, that is the first indication for surgery. Okay, infertile person, low sperm count with clinically palpable varicocele is a first indication for surgery. And other one is chronic pain. When the patient is having chronic pain, chronic throbbing pain, then that can be an indication for surgery. Other thing is youngsters, people who are from 12 to 18 years of old, with varicocele, there can be decrease in size of testis, where the testicular size is low, is decreasing with time, and there is clinically palpable varicocele. That is also an indication for surgery. Okay, most commonly varicocele is done in setting of infertility. With varicocele correction, there is only surgery is needed for varicocele. There is no other treatment. So with varicocele correction, there is improvement of sperm count. There can be improvement of sperm motility. Most importantly, motility will increase, and most of the infertile men, they will have kids. And this can be done in so many ways, surgery. And most commonly performed one is microsurgical varicocelectomy. So this can be done under anesthesia, spinal anesthesia, and can be done, the patient can be discharged on next day. If the patient is not having any symptoms and he is not infertile, his sperm count is normal and his testicular size is normal, there is no need for treating varicocele. Okay. So other thing, important thing is after varicocele surgery, so you have to wait for 3 months. Immediately the patient who are infertile underwent varicocele surgery, you have to wait for 3 months to check for semen analysis to see whether the varicocele after varicocele surgery count has improved or not. So the problem with varicocele is even some patients, even with very good surgical procedure also, some people may not have proper improvement in sperm count and sperm motility. That may be because these patients may be having other problems related to infertility. So that is why you must know that so all varicoceles doesn't need treatment. So only varicoceles with infertility, chronic pain, and varicoceles associated with decreased testicular size only needs treatment. So, and some patients even after varicocele surgery also may not have a very good improvement in sperm count and motility. That you have to understand.